This is an instructional video for a clean dressing change for PN 128, and I am Mandy Roos. Before a dressing change, you would want to check your physician orders to ensure that you know the type of dressing change and how often the dressing change will be conducted. You then want to gather all of your supplies. For the clean dressing change, I have 2 pairs of clean gloves, hand sanitizer, tape, 4x4 gauze sponges, an abdominal pad, a blue pad, and a red biohazard bag, and a pen to write on the dressing after I change it. You want to provide privacy for your patient. And as you gather the supplies and bring them in, you want to introduce yourself to your patient and be checking for 2 identifiers. I'll grab some hand sanitizer real quick. And we'll check a name band here. This is Mr. Surgeon Mackey. And we would ask him his name and date of birth to ensure that we knew that as well. We can go ahead and let him know what we're going to do, and hopefully he would have been pre-medicated with the pain medication about 30 minutes prior if it was oral. We can fan fold the blankets, which means we're just going to expose the dressing that we're going to be changing. I've already used hand sanitizer, so I'm just going to grab my clean pair of gloves. And I am going to place a blue pad down in case I need it. And I'm going to have my red biohazard bag ready. The first step that I want to do is take off the old dressing. So I would want to go ahead and loosen up all of the corners of the dressing. And then I'd want to peel it away and then inspect the dressing. And as I look at the dressing, I'm looking for the color and the amount of drainage. Bright red like this would be sanguineous in documentation, and I would say this is a moderate amount. I would then dispose of that into my biohazard bag and just inspect the wound for any signs of infection as well, noting any redness around, any drainage, especially green or yellow drainage noted, or foul odor also. I would want to note that, which could be potential signs of infection. I would then remove my gloves, placing one inside the other, and then perform hand hygiene. After this hand hygiene, I can get my supplies ready. So I can go ahead and open up my packages. You always open them sterilely away from you. And try not to touch them. Although this is a clean dressing change and not necessarily sterile, we do only want to touch the edges of the dressing. And we want to keep the dressing as sterile as possible, because that is what is going to be touching the patient's wound. I'm going to gather my tape and my pen. Now I can put on my other set of clean gloves. And I'm just going to grab the very edge of the 4x4s and just going to gently place them over the wound. Again, barely touching the edge. And I will do the same with this is called an ABD pad. Barely touching the edge. Now I can leave it folded like this, because this will adequately cover my incision that this patient has, or if I needed a larger dressing, it does fold out these AVD pads. I am going to keep it together and place it over. At this point, because the wound is covered, I am able to remove my gloves. And then I can tape the dressing down. Tape does stick to gloves quite often, and it can be more feasible just to change out or take off the gloves before taping it down. For taping down a dressing, we do a process called window box, or some people call it making a picture frame. It's essentially just ensuring the tape gets in a nice square around the dressing and that is adequately to adhere to the skin and the dressing to form a nice barrier. I want to tape it down all around. And make your nice window box and just ensure that all the edges are nice and sealed. A last step I would do would be to document this dressing change with the date, the time, and my initials. There's no question on when this dressing change happened, and another nurse coming on will be able to see that this was indeed changed today. I would then cover the patient back up, ask if he has any immediate needs or needs that I may help him with at the moment. If he does not, I would set his bed back up to the appropriate height or level that he was at prior, and I would clean up all of my supplies. Do hand hygiene, and then I would document my findings in the electronic medical record or via the chart, noting that the dressing change was done, the time it was done, how the patient tolerated it, and if there was any drainage noted on the dressing or from the wound, and of course any signs of infection like I talked about, any purulent drainage or redness around that wound. And that completes the clean dressing.